Hello, my name is Kristin Cantrell, and I will be doing my presentation on the impact of the opioid epidemic on American healthcare. The misuse of and addiction to opiates, including prescription pain relievers, combined with the overprescribing of these opioids, is a serious national crisis that affects public health today. The abuse of both prescription and illicit drugs has increased dramatically and has become a major public health concern. According to the CDC, the number of overdose deaths involving opioids has quadrupled since the 1990s. It has become a major crisis that we deal with in hospitals, in our work environment, in the nursing field. 130 Americans die every day due to opioid overdoses in the United States. The financial cost of prescription opioids totals to $78.5 billion annually, which includes healthcare expenses, treatment services for addiction, loss of work, and legal activity due to the growing opioid epidemic. The opioid epidemic affects physicians and healthcare providers in so many ways. The prescription drug monitoring programs are databases designed for healthcare providers and physicians to view patients' prescriptions to guide the way that they will prescribe for that patient. The prescription drug monitoring program requires physicians to document by utilizing a prescription monitoring database. Timely data is vital when it comes to prescription drug monitoring programs to ensure patient safety. Nearly 2 million physicians and other healthcare professionals are registered to use the state-based prescription drug monitoring program. The prescription drug monitoring programs are databases that are developed just to address opioid prescriptions and how prescribing practices relate to the opioid epidemic problem. They're run by the state, and they receive and gather data for pharmacies on controlled substances that have been prescribed. The benefit is to assist the physician to have access to the data to show what the patient's prescription history is. It can also show a great distinction between a true indication for opioid prescriptions and compared to abuse or diversion of opioids. Through searching on this database, the physicians can take steps that can also show red flags of any kind of opioid addiction. The Comprehensive Addiction and Recovery Act, also known as CARA 2.0, was designed to bring public awareness of opioid use disorders, especially the connection between prescription opioid misuse and heroin use, as well as the serious deadly risks of fentanyl. First responders can administer a drug called naloxone, which can be used to treat an opioid overdose. This provision allows for financial grants to be utilized to educate and train first responders to ensure that their safety regarding fentanyl and train the first responders about what to do if they're exposed to a dangerous substance like fentanyl. In addition, medication-assisted treatment, also known as MAT, is the next provision. This allows for physician assistants and nurse practitioners to prescribe buprenorphine with the supervision of a capable physician. This provision grants the state authorization to disregard the 100-patient limit that a physician can treat patients with buprenorphine for opioid addiction. The next provision included is the use of the drug monitoring programs, which we already talked about, and they can access those every 3 months as part of the CARA. In addition, to prevent pill mills and the rapid increase of opioids being supplied to patients when it's not deemed medically necessary, the Department of Justice started the Opioid Fraud and Abuse Detection Unit to increase the monitoring of healthcare providers and pharmacies who are providing excessively large amounts of opioids which are not medically indicated or necessary. The second solution is non-pharmacological approaches and holistic solutions to pain relief. While it's recognized that opioids are not always medically necessary, there needs to be another option available to patients who are experiencing physical pain. turmeric, willow bark, cat's claw, ginger, and magnesium are all available options for pain relief. There are many non-pharmacological approaches to take to help with pain relief rather than just utilizing opioid medications for pain relief. Another solution is to use nerve blocks and other medications. The government needs to promote alternative pain treatments. The government needs to put focused effort into promoting alternative pain treatments that can replace the use of opioids for patients, such as non-narcotic medications and nerve blocks. Post-operative pain management after surgical procedures includes nerve blocks, non-steroidal medications, gabapentin, and acetaminophen to reduce post-operative opioid treatment and reduce hospitalizations after surgical procedures. The optimal treatment for pain management should be to seek a holistic solution for pain relief or a non-pharmacological approach to pain relief, such as turmeric or magnesium, or for a physician to attempt a nerve block or a non-steroidal medication or gabapentin. But if those medications are still not effective, it is necessary that an opioid is prescribed. Physicians should be educated regarding refraining from prescribing high-strength opioids and every other alternative prior to resorting to prescribing any high-strength opioid. To make a major change and improvement in the opioid epidemic, there needs to be more restrictions in order to encourage and make a shift in every single physician cooperating and participating in the prescription drug monitoring program. Every single physician in every state needs to be legally mandated to utilize prescription drug monitoring program every single time an opioid is prescribed. Physicians must try holistic pain relief and non-pharmacological pain relief prior to prescribing powerful drugs such as opioid medications. Furthermore, my recommendations are that insurance companies should not authorize pain medications such as powerful opioids if other holistic or non-pharmacological alternatives have not been at least attempted first. Thank you.